As part of a Children's Bureau initiative to raise awareness of tribally engaged prevention and intervention efforts, the Center for Native Child and Family Resilience partnered with 5 tribal organizations, including Indian Health Council Incorporated, to identify and enhance culturally based programs designed to strengthen community and family resilience in American Indian and Alaska Native communities. The Center is committed to building the evidence base of tribal child welfare knowledge and practice through evaluation and sharing the knowledge gained through these projects with the field. The IHC is a healthcare consortium of 9 federally recognized tribes located in an 1,800 square mile service area within North San Diego County. It has operated as a 501c3 nonprofit organization since 1970, with a mission to continually nurture a balance of physical, mental, emotional, and spiritual well-being. As part of their goal to empower and nurture Native family wellness, IHC has a major emphasis on community building and continuously builds collaborative relationships with the greater Native community.
We were starting off with child welfare, Indian child welfare, and chasing court cases and kids in foster care. And once they entered into foster care, it was really difficult to get them out and get them back with families, and sometimes families didn't reunify. And I just started thinking, how can we do this work and prevent them from ever getting into the eye of child welfare services? And to me, that meant working the immediate assistance in court cases, the middle of that, and doing prevention work, but doing like pre-prevention work and working with mothers who were just becoming pregnant or starting out with their families, and starting with young families and trying to teach them communication skills and good parenting skills, and kind of going back to our culture and how we did things before to prevent them from ever getting into the eye of child welfare services.
I was already in the curriculum development as a consultant, so I was helping create the curriculum. I was paired with Art Martinez to do the Lessons of the East, and so once Maria decided that she was going to move on, that's when I jumped into the position and took on the role of the second My Two Auntie. So the program in and of itself is just amazing, in the sense that we get to follow the gestation of a child into birth and then up until the first year of life. And we get to see all those brilliant milestones, getting them ready for delivery and easing their minds about all the different things that happen through pregnancy. And it's like, I gained 10 pounds. In our work, we found that a lot of our youth didn't have the connection to the culture with removal and with just generational trauma and generational or historical trauma. A lot of families have lost their culture, and so this is a way of regenerating that tie to the community and reculturalization. So it's bringing people back into the fray. It's taking them, it's bringing them back, it's throwing them a life jacket, in the sense that, you know, they didn't have these tools when they were growing up, and therefore now here we are saying, here, take this book in your language, learn your language, teach it to your children, make it their favorite bedtime story. Here's a song that you can sing during diaper changes. You know, here is a lullaby when they are at unrest, because we know that language, that connection, the culture speaks to our spirit.
That stigma has been very hard to overturn because of the trust, and for good reason. In our community there was a lot of distrust, and we were seen as working with the enemy. and not really seen as child welfare services was a department that was there to help people. That was really hard to convince people because they were the people who would take children away. So by developing a project that worked alongside with child welfare, we were able to train those child welfare workers into working with our community in a way where our community was accepting them.
Maybe there's a bully at school and mom and dad are going to go in as, you know, mama bear and papa bear, and maybe it's not at that point yet. So you're trying to find somebody to guide you in the sense that, oh, you know, well, you know what I would do? I would just tell them to beat sand or something like that, and just have another person to share these troubles with in a light air. Mm-hmm. Mm-hmm. And then the other portion of Aunties is, you know, we're there to pick up the pieces, because as any parent knows, you're going to have one in daycare, one sick at home, 3 running around the res, you know. So mom and dad might not have the ability to slow down and see things as they arise. But if you like pull your auntie aside, or, you know, I want to go to auntie's house, that's when that one-on-one comes into play. And that's when, you know, behind closed doors, auntie can be like, hey, you need to pay attention to this one. They're struggling. And that's when the term, it takes a village to raise a child, that's where that comes in. Because, you know, we want to be able to pick our children up through the cracks. Because as every parent knows, there's always going to be blind sides.
And teaching children like the language. So we do have storybooks with lullabies in the Payanquechua language. And I think that makes them feel closer to home and closer to their roots. So just definitely providing these things for them. I think it just, it doesn't just feel like I'm getting services from a clinic. It's, okay, this is my clinic, this is my people.
So a colicky baby, you know, when everything else is not working, try that language and see if that helps. Because, I mean, especially with, you know, the languages around here, they're very guttural, you know. So it's like those hard guttural sounds can actually be kind of like white noise in a sense. And it can bring the child back to a state of calm. And then they want to learn the culture for themselves. And then sometimes we also have clients who are non-native but have native children, and they want to learn the cultural traditions and values in order to pass it on to their children. And it's difficult as a non-native to come into the culture and to find somebody who will teach them. So to have the indigenous ways of knowing curriculum, it gives them that life jacket again of, oh, finally, I found somebody who can help me teach this to our children.
And understanding those principles and how they relate to today's modern world and the skills that they need. Simply being available to your children, waking up with the children, waking up before the children wake up, just something that simple. Really helps your family get organized, and getting kids off to school with the meal in them helps them learn. You know, just simple things like that. Yes, it's our job, but when we hire people to become an auntie, it really is like being a part of your family and having that person be just like your auntie would do, come to your house early in the morning or late at night when you need them the most.
The way our clients identify with these lessons, and they feel really comfortable with the lessons that I've delivered so far. They love the program. and they feel comfortable. And again, we're involving them and we're letting them know what it's about every step of the way. So just getting back all the positive feedback, I think and them feeling comfortable with us, I think that's the greatest success.
I found that one of the evaluation tools that we use is the mind map of like the word cloud tracker. And of course that's like the mother oak with all of her leaves, and then words surrounding that. And in that's where I found the connection with the clients, because in closing, that's the last thing that we do is we go over the word tracker in how did today's lesson make you feel, or how do you feel in general today. And I found that it really opens the door to communication, to building those connections. Because if you're working with a client and one day they go, oh, I'm a little stressed, and it's just like, okay, that's totally understandable. You're pregnant, there's a lot of things coming at you right now, and okay, cool.
And we also have from the grant that we run this program out of with UCSD, and those evaluations, they really warmed my heart, brought me to tears, because they showed the same findings. And the findings were basically, it's working. I think what makes me the proudest is just knowing that we're leaving something behind, and something that can grow and that can become even bigger than what it is today, because it could take off with more language, more programs, doing the indigenous ways of knowing, and bringing our culture into everything that we do, and give that sense of pride, resilience, strength to our little ones, all the way to our elders. So it's kind of leaving a legacy.
CNCFR and My Two Aunties have collaborated to develop a curriculum and supporting implementation guide. These materials will help organizations or tribes that would like to implement this program in their community to do so in ways that are congruent with their culture, values, rituals, and communities. To learn more about the My Two Aunties program and access program materials, visit the Indian Health Council website and the CNCFR website. The Center for Native Child and Family Resilience was funded by the Children's Bureau, Administration for Children and Families, U.S. Department of Health and Human Services, under Cooperative Agreement Number 90CA1853. The contents of this product are solely the responsibility of JBS International Incorporated and do not necessarily reflect the official views of the Children's Bureau.